So we have a tendency as massage therapists to overuse certain body parts when we're treating, but we have got a wide array of different things that we can use to apply different pressure, different levels of depth without as much stress to the therapist. So we've got open palms, we're covering a lot of surface area, nice and light. We have to push very hard to get deep into the tissues here. So what we want to do if we want to get deeper into the tissues is to decrease the surface area. So we can do that by going to knuckles, nice relaxed fingers, straight arm, keep over the top of the stroke, slowing down because we're going deeper. We can reinforce those knuckles with a cam and spindle technique, where the push is coming from the left hand and the knuckles are completely passive. We've got thumbs, always make sure they're reinforced. I would usually reinforce with a full palm instead of just another thumb, just like that. We've got stylo process of the ulnar, which is that bony bit there, which can be quite helpful on certain body parts, not great for this bit. And then we've got forearms and elbows, which are great to practice because this can save you a lot of bother when it comes to thumb issues. Make sure you keep the wrist nice and relaxed, and just remember that the more of an angle you've got at the elbow, the more pressure you're going to apply and the more likely you are to slip off. So working back with the forearm superficially and then deeper in with the elbow, making sure I stay away from the spine. And if you're worried about coming into contact with the spine, what you can do is pop your index finger on the spine like that, thumb out, and you create this little hole for your elbow to go in, and that way we know we're not going to be interfering with the spine and cause any pain. And the last one from there, really nice up the ribs, up through the lats into the scapula, is some broad forearm pressure. Just make sure you're down nice and low, put the pressure through with the right hand onto the left wrist. Nice relaxed wrist, so you can feel what's going on. And we are going deep even though we're quite broad. So make sure you go nice and slow so you're in control. And my elbow is actually coming along just on the inside of the spine there, so just be careful, but it can be very effective in getting into those deeper muscles that run either side of the spine.